Happy Friday, folks.
Happy Friday. Eric's in our backyard, man. We got a closer guest now.
Yeah, Eric North.
Where are you guys, by the way?
Baltimore.
Oh, wow. Okay. I love Baltimore. Okay,
Yeah,
cool.
we're not too far
I used
away.
to live there for a while.
Eric North, welcome.
Thank you for having me. I appreciate you guys. What's going on?
Yeah, listen, we just had our school system here in Baltimore County
Just
cancel
closed.
school 2 hours early. So I'm like, great. So what the hell's what? They're like, well, there could be a potential possible
There
problem.
might be
so
snow
we're gonna,
at 5
man,
p.m. tonight, so we're going to close now.
yeah.
It drives me crazy. I think, we were kids. I grew up in Virginia. I grew up in Northern Virginia. And I think it was a lot. I mean, I don't remember. I think it was a lot colder back then. And we didn't really getting 2 hours off early was a big deal.
It was a big deal.
A day off was like a real big storm, right? So.
Yeah. And now we get a snow day if it like somebody suggests the word snow.
Yeah, it's funny.
I would have thought COVID, honestly, the one good thing that could have come out of COVID is we just would have worked out this no snow days.
The online stuff.
Go to online.
Well, we didn't do a good job at that either, though. So I did that with my clinic, though. I took my clinic to telemedicine 5 years ago.
Yeah.
It is the best thing I ever did. It really helped us a lot.
That's an interesting segue there, Eric. Tell us a little bit about the clinic, because normally the only question we have is how'd you get here?
Yeah,
I grew up the child of two entrepreneurs. My parents they both had. My mother didn't have a career at all. My father started a company, and they both worked together really hard to do this company. I kind of grew up 13, 14, 15 working in the company all the time, and we had probably 30 or 40 employees at one time. So I had an entrepreneurial spirit, and then I went to college and did the business degree they thought that everyone wanted me to do, and I did corporate stuff for a while, mostly defense contracting work here in DC, and I got really over it. It was just done. I was really into like physicals. I've always been an athlete. I've always been into weightlifting since I was like 15. I've done bodybuilding, physique competition shows. But I was at a point where my career in DC, I was like, it was just such a drain. It was 7 days a week. They catered food on the weekends, so we'd come in, and I just quit one day. I was like, I don't want to do this anymore. I don't care what the repercussions are. And I took a year off. I just traveling. I probably partied a little too much as in my 30s. And then I became a personal trainer, and I was up at 5 a.m. training clients every day after I did that. And that kind of got my self-discipline back to where I really wanted it from my parents' teachings as an entrepreneur. And then I became a real estate agent. And that was a really good job for me because I'm trustworthy. I'm always I tell you this, but I'm always really good. I always had my clients' needs at heart. So I had a good reputation. And then I had low T. I didn't know what it was. It was like 15 years ago. It was like something I didn't know if it was treatable. I had a little help with my doctor, but I was kind of hitting a wall. A high achiever. I'm always busy. I was a trainer. I was this. I just got married. And all of a sudden, the only thing I had left in my competitive thing was to be competitive at work. I wanted to keep on top of that. Come home and sit for 2 hours after work and just be like, didn't do anything. Sit and stare at the wall for 2 hours because I was exhausted. And then a buddy of mine, because I've lived in this area for a long time, and a really old friend of mine called me out of the blue and said, hey, I just went to this clinic in Florida. It's legally prescribed. They have a doctor. You can get therapy. It may be I recommend you doing it. And I was really kind of like, okay, let's see what happens. And in a couple of months, it really changed everything. And I have a way of just kind of, people trust me usually. And so the owner heard about me from the guy I was working with and said, hey, I want to go into business with you. Let's talk. And that was kind of the beginning of the journey. I was like, this is my own business now. I could do something of my own, and close the door and not have a boss, which is really nice too, have your first office space. So I started the clinic. It was a lot. It was a lot in the beginning because there's a lot of pushback against TRT back then. People were terrified of it. I think they still are in some ways. There's a lot of misinformation out there. So a lot of my job has been to rid people of misconceptions and theories about what's going to happen to them and help them get therapy in a kind of a holistic, healthy way. So we do it really personalized for each patient. And that's been my passion for like 15 years. And then now I'm the happiness warrior because I had a lot of people telling me that you need to do something. We're motivating people. Everyone kind of congregates around me. I'm out in public. I have a lot of friends everywhere immediately. And I thought, and then an agent in New York, a modeling agent that I just knew, he was like, "You are the happiness warrior. Let's start calling you that from now on. Let's get you going. Let's get you on TV. Let's get you talking to people." And it was like, I was like, okay, that sounds cool to me. I'm always ready for an adventure. And I thought, I'm going to take over and I'm going to become the happiness warrior, as myself. It's become part of who I am.
And how long's that been?
It's been about 2.5 years, 3 years. I've been working with a really good PR team here in DC for the last just over, I guess, about a year and a half. And I'm on TV. I'm on TV a lot now. That's my big thing, is live television. I do sort of movement, stretch therapy, mental health, physical connection, the physical mental health connection with people. And I have to perform for like 4 minutes to do something fun. If they'll
yeah. Getting everybody up in the morning, right?
Yeah. In the morning, yesterday I did a whole hour talk show on Fox 5 here in DC.
Nice.
Oh wow.
They've been really supportive. So what my dream is coming true. I love being an entrepreneur. I could just be happy by doing that, but I wanted more. I wanted to be able to do more to help people in a more organic way rather than just having a business,
So there's a lot to unpack there. You're the only person I've met, or first person I've met in a while that talks faster than I do. Like, my God.
I'm sorry. Yeah, I'm a little hyped up today.
That's good, man. That's great. That's great. It's Friday afternoon. Most of us are dragging.
Yeah, listen, it's time to get this show on the road here. Okay, so lots to unpack here. Let's go back to
anything.
Let's go back a little bit, because listen, I'm smiling and Tom already probably knows where I'm going with this, but we have a lot of guests on here that we call the wounded healer type mentality, right? Like somebody who had something happen and then all of a sudden they're good at the thing and they're doing the thing, which I think is great that there's so many people like that out there. But you're not the first person that had a T situation going on here. So how did you even identify that? Because I just want to Venn diagram you with the other guys.
Especially if you're kind of like kicking ass already,
Yeah.
Well, I was kicking ass, but I had a really good physician here who's in DC. Is a small town, so he was a friend of mine too. He was a really good guy, and he was very careful. We did testing, and I told him I'm starting to. I didn't want to admit it, but I was like, this is something. My energy levels have just crashed, and I don't even feel like myself. I feel like I'm not a depressed person clinically. I don't think you could really diagnose me, but anybody has a little bit, I guess. But I was just feeling like this is not how I want to live the rest of my life. I don't want to feel this way. And then when I found out that I had options that were not backroom guys at the gym. I didn't know what that was. There's people, selling.
We've talked to them too, Eric.
There's plenty of those. I know. I used to be a competitive athlete, and I know all that. I know that world. I like everyone. I like hanging out with the guys, though. And it's just and stuff that men talk about together is usually stuff like that. It's usually about working out and nutrition and boring stuff. I think really, but it's just it's what we talk about when we're just relaxed. And so that's kind of the arena that I'm in too. Is that world is fitness, motivation, and then having the ability to portray myself through my clinic is incredible. So
and I think that it's funny. I'd love to hear your take on this, but I think one of the funny things, funny as in curious, not that I've noticed is that so much of the planet. And I'd say like a lot of people I know in particular, like just assume that all those things you described, like, oh, my energy's a little low, maybe my libido's a little low, whatever. It's all sort of like part of the quote unquote getting older.
Yes.
Right. Yes. Like, and it's like all sort of like inevitable, like you can't fight it. And then to make that worse, when you have a show like this that we have, and we're talking to a bunch of cool people. I mean, Tom and I think they're great people, right? But to the standard,
so. I agree.
Yeah, of course. Yeah.
I see the show. It's great.
But like, here's the thing though, like if you're a muggle of sorts, right, and you're not in this world, like a lot of what we talk about is batshit crazy. They're like, oh, you're just trying to chase the fountain of youth and blah, blah, blah. There's a whole bunch of things packed into that. Like, what's your experience with that too? Because I got to imagine once you start doing it.
When I first started doing it was in 2011, at the end of 2010, 2011, I started putting the clinic together and our medical team and everything. And I would go, and I was in good shape back then anyway. I was in good shape at the gym. I've always been kind of like, I hold myself to a different standard to myself, not because I'm going to be better than anyone, because that's how I was raised. That's how I was raised. My parents were taking us running when we were little kids and we were working out in the park. It's a normal thing for us to do. So to let them down too, to let anyone down that knew me, I just stay in good shape. And people would ask me, what do you do? And I'd be like, I have this clinic, and they start walking away from me. Yeah. They're just cold, off. They're just
and Eric, anything other than the HRT? Or is it you guys pretty much doing straight HRT?
No, we do a full range of longevity medicine. So we have
All right.
the full range of real, actual American-made, purity tested peptides that are the real thing. They're prescribed. They're from a good pharmacy. TRT, I think, I think nowadays TRT is probably 30% of our practice.
Oh, that's great. That's good to know.
The peptides that we can do female. We don't do HRT for females, but so we do the peptides that are good for everyone. They can really, and they turn your pituitary gland on. They don't go back like TRT. It's a continuous therapy. If you go stop, you're going to have to start up again. But there's no other danger. There's no danger to it though. There's a lot of fear out there. The other thing, and there's no danger. So it's not, you're not addicted to it or anything like that. But with the peptides though, they're so incredible because they help the body heal itself. And that's really where I am. I'm not about loading our patients up. I hear about other clinics that just load them up with lots of stuff that they don't need. Or they use fear. Fear is a big motivator.
Right.
It keeps people from doing things. It keeps people from moving forward. But also makes people buy more. It makes them afraid they're missing out on something. So I want to make sure that with our clinic, we have ethics and we have integrity, and we're doing what the patient wants us to accomplish. And with the weight loss stuff too is amazing as well.
Yeah. So it's interesting that people just
are you
away
including
from you.
the GLP-1s in that?
We do a full range of the GLP-1s that are custom made, so they're not just like when you're giving yourself regular physician, a primary physician who's prescribed something like that. That's great. It's going to help people, but if you prescribe too much at one time, it's not a cookie cutter approach for everyone.
Yeah, right.
Some people don't do well on it at first, and they need to have massive adjustments all the time until they get the right place where they're doing the right amount, they're doing the right dosage, and then they get good results. But you have to be patient with them too. A lot of times they'll start. I'm so fast today. I'm so sorry.
No, you're good, man.
Yeah, I know you're totally fine. I'm tracking.
They'll start with a physician, and then it won't work, and then they'll be done. And they're on to the next patient, and that patient's just kind of like, what doesn't work for me? This stuff sucks, and you hear that all the time. And I just like, and that's why for me, a lot of it is hearing my voice. I do videos and I talk about stuff in such a way that I don't want anybody to feel like I'm pointing fingers, but I also want them to feel like they're okay. They can come and try this stuff. It's not going to hurt them. Here's why we're not afraid of this. Here's why we don't want to live in fear anyway, in my opinion. But it's a terrible place to live. But I do get that a lot. In the beginning of my clinic, it was so funny. I had to use myself. I had to take my shirt off and do advertisements, and it was just like, and that was like such a different time period for me. And as I'm matured, I have a good team. I have good people working for me. I'm very not much the face of the business as much as I used to be. Which is great. I want to have other people in the sunshine besides me, of course.
Sure. And it's funny because again, my bias is this show, obviously. So like the people we're talking to, going in for TRT, like in your 40s, 50s is like 30s. Not. Yeah. I don't know many people. First of all, I don't really know that many 30-year-olds. So but second of all, I don't know a lot of 30-year-olds. The ones that I do, I don't know that at least they're not talking about it out loud.
So what I've done in the last 15 years is I was kind of one at the beginning. I was kind of one of more of a trailblazer in the clinic area, I think, as far as in the beginning. So what we've done, all clinic owners, I know a lot of them around the country, we all have to kind of fight for our place that we can, our legitimacy, so you can see that we're doing good work. Right. And it's an uphill battle, but it's becoming mainstream now. So it's not as, most people that call me now are like, when can I start? When can I make an appointment?
Yeah. They're already sold into the process.
Before it was 10 phone calls and one more question, and then they get started, and then they quit on themselves too. I'll tell you, a lot of humans quit on themselves quickly.
Oh yeah. Well, I mean, to tell you where I'm at, we've had a doc on the show twice, and he's doing a clinical study now with to put men in the 85, 90 percentile of their T zone for their age, and then measure. Great. Yeah, and I was like, yeah, sure, sign me up. Like,
I'm in.
On air.
Like, honestly, he's talking, and I'm going like looking at the vials as he's talking.
As we age, we're going to need new things to keep ourselves going, and I think we also live in a world that's very estrogenic. There's a lot of chemicals. I'm not I'm not a conspiracy theorist or anything like that, but we're breathing all these scents and things, and everything is getting inhaled and going to our lungs. It changes what's in our water supply. We're getting more estrogen hormones than we are testosterone. Testosterone numbers are going down every year. So
You know what, Eric? I don't know if you've seen these commercials where they're kind of almost blaming men for that, right? Like they're not looking at the environment. They're like, back when your grandfather, and it's like, yeah, my grandfather didn't have microplastics in his semen.
They didn't. That's what I'm saying. The world has changed. The world has changed. And do we want to? I'm like, I want to get through the other side and survive.
Yeah.
Okay, we got to go through the fire sometimes, but we also want to be as strong as we can because
sure.
we live in such a I'm not going to ever be political on here, but we live in a very crazy upside down world right now where a lot of stuff is happening.
Oh, you can get political, Eric. It's cool.
No, I don't want to at all. But how do you stay? I live in DC. How do you stay?
Wise move.
The best way to go forward is to be strong from within. You know, so when you can fight, I say you're steering the ship through a big bunch of waves. You know, you're not. I know where I'm going. You can come along with me because we're going to get there safely. It's going to be a little rough, maybe. Yeah. But we're going to. I'm strong in body and mind. I was ready for COVID. When COVID happened, a lot of people asked me to come on and talk on their Zoom calls and everything. And I was like, this is a really depressing group of people who are really whining about something that's just happened to all of us. It's not like it didn't single you out. Yeah. It's either a time to be strong and help others get through it, or to go down, you know. So
right. Yeah.
I'm sure you have a lot of people on the show that are like that too. They're not going to let people take them down. They're going to move forward, right?
Yeah. Well, I mean, I think almost exclusively the people on the show are in that camp,
of course.
right?
That's what I mean. I'm not trying to be like snobby about that, but I do think it's when you have people with common mindsets, it's pretty easy to connect. You know, if we have the same goals.
But like I've been in marketing for a long, long time. And I think the reason I like marketing is because of the psychological component, right? Yeah. So a lot of the lens that I like to look at the world through is psychological. I'm like, you know, why do people do this thing? And like, I guess for better or for worse, in marketing, you're trying to manipulate that knowledge, right? But in a general curiosity sense, I mean, biohacking, right? Like, although we hate that word, it's interesting that we're just a chemistry set. So like, again, I know it's a terrible word. We're trying to find it.
It's loaded, Eric.
I thought I hated that word. And I just did a blog for my website for the clinic, and it was about biohacking. And the blog writers from our marketing team did it. And I said to my clinic director, I said, you know, I really hate the word biohacking, of course, but it's also very big right now. It's going to get us a lot of clicks right now. But if you're biohacking there's a right way to biohack, and that's to use all the tools that we have appropriately. So that's to use TRT. That's biohacking. If you're, I think we overdo supplements a lot. A lot of pills, I think, are just a waste of money. But you know, we're biohacking. We're doing, you know, GLP-1s to lose 20 pounds, but you're also making your brain healthier. You're making you more resistant to dementia. So we're using these tools because we're trying to survive in this changed environment, and we want to move. Humanity has to exist, right?
Is that a thing? You can GLP-1s help stave off.
Oh, they absolutely do. The number of people that quit drinking.
Really?
I don't need to lose any weight. I use a low dose, a micro dose, which is, I hate that word too, because microdose.
Everyone's microdosing something these days.
What does that mean? A micro, you know, they're probably high as can be, but when you're using you know, most people are probably lying, but a microdose of the GLP-1s, I noticed that there's less food noise. I'm very active. In my household, we're bikers, and we're always riding in Rock Creek Park and walking my dogs, and I have a lot of cookies around. And that's food noise. Okay. So I never thought of food noise until recently. Someone kind of brought that to my.
I like that term, Eric. I really like that term. As a family of like sugar addicted motherfuckers.
It doesn't have to eat us up either. It doesn't have to make us feel bad. Because if I have a donut, I'll tell you right now, I'm going to confess to you right now. I had a busy morning. I had a diagnosis I was waiting for that was a negative. It was good. It was from a biopsy. I was kind of keyed up. I was waiting for this. It was a prostate biopsy. There was nothing wrong with me. I had an infection.
Well, good for you, Eric. There.
He was like, good news, but I was keyed up. I knew it was going to be good news, but I keyed up at 10:30 this morning. The doctor and I talked, and he was like, you don't have cancer. It's good. You know, we're all good. But I'm glad we just checked and did everything. But that's probably why I'm so fired up right now.
Yeah, no, listen,
that's all right, man. We'll celebrate a win.
Really
man.
Good news, and I wouldn't if I had it, I probably wouldn't have talked about it too much in public either. But I'm okay talking about it now because
because it's not
it is
a problem.
something that really is. I wasn't really worried, other than the fact that it took 2 weeks because of the snow to get the results.
Oh Jesus!
So
Right? Yeah.
everything was slow.
Everything's slow.
Yeah. So I was kind of like, yesterday he wanted to talk to me, and I was on live TV for an hour, and I didn't want to have that interrupt my day.
No.
Yeah, for sure. And like, that's the kind of thing where you're like, listen, knowing this information is not going to change anything, but knowing it before that show will. So let's just put it off.
My doctor knows me. He knows me now, and he's like, you're just going to make sure everything that you're going to make sure. He said, even if it was, I knew you were going to take it so strongly that it would be done and before you know it. So yeah.
My doctor, actually, funny. I went to a concierge doc a few years ago because I got sick of having overly detailed conversations with people.
NPs that don't know you.
Yeah, exactly. Yeah. And so he said he wouldn't let me take the Galleri test at first because he's like, look, there's a huge false positive at the time. This was several years ago. Yeah. And I said, he goes, listen,
sure.
But then last year, he said, he calls me up and he goes, listen, they figured it out. The numbers equalized. You're the only patient that I'm going to tell this to, but I think you should get it. I know you want to. You can handle the false negatives.
Right.
Or I'm sorry, the false positives, because now it was false negatives before, but now the false positives are about 50-50.
Yeah.
So he's like, listen, if you get an abnormal marker in lung and kidney, you're not going to go thinking you have lung cancer and whatever. I said, well, I probably will, but I'll at least keep it under control.
But you'll at least be in control. Yeah.
Right. Exactly. Yeah. And so he said, but he same to your point, like he knew me well enough to be like, listen, I'm going to slow roll this out with patients. You're definitely going to be one of the first because I know you can process this appropriately, and nothing came back on that. But I'll tell you what, I never slept better in my life than that night. I'll tell you what. That was like the best night of sleep ever.
Wonderful. That's great news, though, because I don't know how you get to a point in life when the odds start to catch up to you too.
Yeah,
right?
yeah.
Like we said, you're just getting older, but that just getting older is a really depressing statement too.
Yeah,
so,
well,
I mean, it's almost kind of giving in.
It's giving in. That's what I mean. I'm not. My whole thing about when I'm speaking to people, I'm trying to help them see their lives differently and see their value differently too. See their value better than they see. And a lot of times it's bringing those kind of things out of people. You have to get rid of that negative self-talk and that kind of, are they content just staying in a bubble all their lives and never having any change, or growth, and getting through that period with stuff. And so finding out that you're healthy too really helps a lot with optimism too. Right?
And my wife obviously makes fun of me a lot for stuff like this because I'm obsessive about it. Like it's nonstop. I mean, I started a fucking show about this, so like it's definitely like
that's the spouse's job. Okay.
Yeah, totally. Listen, but like she even was like, I could see this one. I see, like, I can kind of like, it was easy for her to, and I'm like, so you should go take one. She goes, that's ridiculous. I'm not doing that. And I was like, okay, cool. Like, I mean, I don't understand it.
It's great for you. She's happy for you.
Yeah, exactly.
Happy for you. Right.
But you know what I like about this too, and I guess I want to kind of get into the testosterone's an easy target, but I want to talk about your sort of broader view on this, because I think what has become clear, again, totally prejudiced through this show, is that the options to optimize an aging population are abundant, like almost infinite, right? Like they're fucking everywhere.
Expanding. Yeah.
And like, if I'm 49, 50 this summer, that's getting up there. It's not. I'm no longer the youngest guy in the room. Haven't been in a while. I'm not the oldest yet, but I now can see around that corner. You know what I mean?
Yeah,
it really does.
Yeah, exactly. And that now I'm saying, like, it's almost like our responsibility now to, like, I mean, why would I, especially for my family, my friends, like, why wouldn't I want to take care of myself to be here as long as I possibly can? Right.
Exactly what I say. It's exactly what I say. I believe that we have responsibility to, I think, to be productive in this world anyway, as long as we can. That's just me. People might be mad at me for saying that, but I think you want to have something that gives you purpose.
Yeah.
And giving purpose is also when you have a family, when you have people, employees, you have business partners.
Sure.
A lot of people depend on me, and I'm sure a lot of people depend on both of you guys too, to keep going every day.
Eric, it's funny. We had a guest on. He's the inventor of Neurovisor, this like audio visual entrainment thing, and we loved having him on. And we've had some off channel conversations with him, and I swear, man, I had a foundational shake. That when it hit me that like, oh shit, you're middle aged, and. he's in his 70s, and he kind of was like, yep, you're about 50, right? He's like, this is what happens. And his whole thing was, your purpose shifts now.
It does.
Right?
Yeah,
you know, like we're not
yeah.
just out there trying to chase tail and get married and chase the career. And what is that thing that we're leaving behind? What is that legacy? What are we doing for others now?
Right.
And man, can I tell you, just that one statement snapped me out of it, because it was like, oh yeah, I'm looking here now. That's where we're supposed to be going. So I'm happy that you brought that up. I'm happy that you mentioned that purpose.
It can be very empowering too. You can really open up. I'm always about expansion and opening windows, figuring out what's next. Mm-hmm. Listening. I'm not going to get woo, but listening to the universe is usually giving us, providing us everything we need.
We talked to near-death experience people.
I went to. This is the weirdest thing. I went to Sedona in 2020 to visit a kind of a woo-woo friend, really fabulous woman that I met in Austin, who has a little palazzo there in Sedona, and she does wellness retreats. But we just spent a few days just hanging out and hiking, going to the mountains, and we went to this. We just kind of came up on this big circle of people, and this is during COVID. No one had any mask on. Mm-hmm. It was, like Arizona, I'm hiking. I was nice and free, and they were all in a circle. They had little drums and little prayer stuff going on. It was about 50 people on a mesa. And I was a little bit like, oh, let's just see how this goes. It's not really my scene. Mm-hmm. And I was kind of looking, I really wanted to go hiking. There was a big switchback trail I was seeing up the top of this big mountain, in one of those big red mountains right next to us. And all of a sudden, after about 45 minutes, I was kind of getting into it just because it was lulling me. And I was looking for my purpose. She was helping me that summer. We were looking for like our COVID journey, you know, what's our next step in life?
Right.
And I was looking for answers. And I swear, this is not some kind of baloney. Maybe it was too much sunshine. I don't know. Maybe the altitude. But I looked up at this mountain. I saw like a little door, and it looked like a door. And I looked at, and the mountain said to me, all knowledge is here. Mm. And it was like in this weird voice. I remember it was like a message to me, just to remember that I can handle anything. I can just keep my eyes open, you know, and hear, you know, things. And it was like, I never heard anything like that ever again. It was just a one time.
Yeah, it was that peyote you ate probably on
the could have been the peyote or the tequila, I don't know, mezcal or whatever. No, but it was like, it might have been the sun, but it was like, it was pretty cool. it was almost like what you just said, Tom. I just felt like a little drop there where I felt like reality is okay, you know? So
yeah, and I think that's like another one of those things that gets in a lot of people's way, right? Like this idea that reality is somehow not okay, right? And I see that with a bunch of people that are like, I mean, look, I'll throw my wife under the bus here. Like her saying it good for you on the grail, but not for her. I'm like, well, what's wrong with that? She said, well, if I have something I don't want to know. I'm like, what? Like,
well, then what are you going to do? Yeah, that would be my immediate question is like, how are you going to fix it?
But that's exactly the problem that I see with a lot of people, though, right? They don't want to like just accept this reality as reality and deal with it. They want to pretend like, you know, it's not there or minimize it.
A lot of people I guess it's just protective of people have their own ways of protecting themselves, you know. And
sure.
Like,
I'd agree with you there.
We have to go back to traumas,
right. There's a bunch of stuff that
we are now. And I never blame anything on anyone. Whatever happened in my life happened to me, and that was my story. And there's not a lot of, you know, you have a lot of bad people do bad things to everyone. Has that happened in life? But that's just my story. Is how it made me who I am now. You know, the painful stuff is how you get to the next station in life, the next stop.
Sure.
You know.
Yeah. I mean, according to one of our guests, this is my 267th life. So I'm still working on getting I'm still getting my hands around this cosmic problem here, apparently.
Oh, it's there's so much to think about sometimes, you know? So
yeah, that guy got me into, this is my fourth trip around with my wife. I was like, oh, that's kind of an interesting.
Kind of weird.
Yeah. Well, two of them, she was the husband. That's even weirder. That'll throw your brain sideways,
that's
right?
That's really off. Yeah.
What
did she think about that?
I mean, she joked and said she's still the husband.
She thinks it's great for him.
She's like, yeah, I'm still running this place, so I guess that's
still
fair.
Still her show.
Yeah.
Well,
it's funny. I did a genetic blood testing thing, just not for diseases, but just to like what you could have like the most problems with. And a lot of my worst thing was pollution was in my body. And it was like, because I ride my bike all the time in the city. I don't know what it is, but it's just, you think it's clean air, but I had a high level of pollution in my bloodstream. So how do you get rid of that? And it was like, buy all these supplements,
And you're
so,
like, nope. Yeah.
Well, yeah. I mean, that keeps you consuming.
I'll just keep on riding my bike and being happy and doing the best I can. Hopefully my body will filter things out anyway. But
there was that whole urban legend. I never fact check it because the internet wasn't really a thing back then, but the marathon runner in New York City that had the lungs of a smoker, right? Like, and they all ran.
Right. Well, have you been in New York
yeah, I was in New York for a long time. So
if you look in the windowsill, you'll see the soot just lying on the sills outside of every apartment building. Yeah. So
I mean, I was in New York when you could smoke in a bar. So even though I was also smoking in the bar, I was in a bar one way or the other with a million other people smoking. So
I grew up in the 70s in Virginia, and I'll tell you what, they had ashtrays everywhere that were the size of frisbees everywhere. And when my mother would go there, when she'd go up north to visit relatives, she'd go buy cartons of cigarettes as a happy gift,
Yeah. Yeah. Isn't that wild? I mean, we were just talking about that on our last show. It's like, there's not a lot of people smoking anymore. Like, and it used to be such like a, they're vaping.
Vaping is, I think the vaping is worse for your lungs in some ways too.
I wouldn't argue that. I wouldn't argue against that.
I don't know. I mean, that kind of makes it, you're stripping your lungs. It feels like you're stripping your lungs out with those things. I don't know. So,
well, even on the cannabis side, I had a brief stint with the oil cartridges, like the distillates and stuff like that. And it was very brief because I found there was like this just tax on my lungs. Just it felt very heavy.
I had people give them to me and you see people like even my mother's doing some kind of THC gummy now. So all that stuff is, and she's very conservative. And it's like, oh, there's different rules for you now, okay? And it's different rules. The rules don't apply all the time. But I've seen people with these, and I get a lot of friends. Oh, here, have one of these. It's really cool. And I'll be taking it. I'll be like, this thing is it makes my lungs feel like I'm just going to just cough.
I know that's exactly why I stopped it, and it got to the point where I'd like,
cool.
Yeah, no, I don't feel cool. And then I was walking upstairs one time going to a meeting. And I caught that, that like sideways heartbeat when you're running upstairs, and I'm like, what the fuck was that? Yeah, and I'm like, no, I gotta cut this out. This is crazy.
Yeah, it's a good.
But we have so many versions of that. I mean, like, you're talking about peptides, and actually I want to use this as a bridge to get into the more wider longevity stuff. Yeah. But like the peptide stuff now is interesting because now you get sublingual, you got patches coming out, you got nasal spray, and I mean, here's
what I think. Anything that enters the bloodstream like a nasal spray is good. Anything that's maybe a patch might be good. Injections are really the best way to do most of them right now. However, being in this business for a long time, and I know some pharmacies that are working on this, I think we're going to get rid of syringes soon. It's going to be these time release capsules that are going to like let the peptides actually, usually they'll die in the stomach very quickly, so they'll just disappear. But we're going to see, even for testosterone, we're going to see less injections and more oral things that are going to be well administered without any side effects, and have really a lot less problems than you would have with the injections too. So I think it's
changing
like
there to drive
like record player. It's like the old record, the old record players. We're not going to see as many of those. We're not going to see as many syringes in the future too.
Interesting.
Like you said, it's going to be easier to do the therapy.
Funny enough, my 17-year-old son just went and bought a record player, so I don't know, man.
Oh, I love it. I love But I love it. Yeah. It's incredible. My father was a big stereo guy, so.
What makes you think what's driving the technology change there to make it more oral?
Ease of use, making it more acceptable to people to use. A lot of times the syringes and injections will be a turnoff, or they'll, I had an uncle that was a heroin addict, so for me, and he was he was only 10 years older than me, and he did not want me doing heroin. So he was very open about it,
Right.
Passed away now, but so that kind of growing up with him and having him always running to my father every time he was running to our house, every time he was in trouble, he'd use our house as a refuge.
Yeah.
And he was a wonderful guy, but seeing that to me is anti-drugs. I was always very, kind of horrified by that whole world.
Yeah. Yeah, we make fun of that world a lot on here, say no to drugs, all that dumb shit.
Well, I'm always like, what you're going to do when you start, it's going to go bad when you start doing it, so.
Yeah. Yeah.
Well, I always, that was the one joke about drugs I could always make. I'm like, well, I'll never be a heroin addict because I vasovagal the shit out of even like getting any kind of shot. So I'm like, nope, I'm not a shot guy. You're not going to see me fucking with anything intravenous.
It's gross. It's dirty.
Yeah. Well, even like GLP-1s, someone's like, how come you haven't tried it? And I'm like, it's the shot. I'm not doing the shot.
Yeah, I remember though. I don't like those. I don't like those shot. I don't like the shot machines. So if you have like
the auto injector.
I can't stand doing that. I have a 31 gauge insulin syringe it's a 1/4 inch long that you can bend it. You can just tap it and bend the syringe. Yeah, exactly. And that makes it so much easier. And I just do it. You know what I do mine? I always I don't like doing it in my belly fat. I like doing mine right in my tricep.
Back of the arm,
right in my
You have to do testosterone right into a muscle, right?
But you don't have to. There's different ways of doing it. There's the subcutaneous way you can do it with an insulin syringe, and that can be actually a very safer way to do it.
That's the only weird thing with that is the testosterone tends to be a thicker compound. It's like longer to get in that way.
I've been doing it for so long, for probably 15, 16 years. And I've never had any problems with it. I do the same dose every week. I don't change. Sometimes I do a little less even if I feel like it, but I just do 200 milligrams a week as a standard. I do half on Monday, half on Thursday. So it's a smaller 0.5 ml injection, and I'm pretty much stable levels all week long. And that's really how I sell it too. I sell it as you feel good every day. You don't have a dolphin effect. Sometimes you have clinic and they'll be once every 2 weeks. You're doing an injection. And by the time you get to day 5, your half-life is crashing. You're not feeling good.
Yeah.
So the most important thing for me is to help people just live better, more productive, happier lives without having to worry about it too much.
What's the half-life of tea? Like when you're on that?
3 or 4 days. 3 or 4 days.
Yeah. All right. So a 7-day cycle is way too much then.
It's not way too much, but I prefer breaking it up.
I feel like most recommendations are bi-weekly.
Yeah, most good clinics. I have people testing me sometimes. Well, my brother said to make sure and you answer all the questions you're supposed to answer correctly. I'm like, okay, let's get started, right? So.
Yeah. And that's why I'm actually I listen. I don't know a lot about this topic, so when the opportunity to jump into this study presented, I was like, I'm all in because I'm just looking forward to getting somebody who knows what they're talking about to sort of walk me into the process. Because once I'm in, then I'm sure I'll go down that rabbit hole, or the research rabbit hole pretty hard. But yeah, and what I was shocked to know, do you have any female clients on the testosterone thing? I didn't realize that was a thing.
We don't do female sex hormones. That's one thing that our clinic has never done. We've always been sort of in the original first 10 years. This was a men's longevity clinic, and we just wanted to have a kind of, I would say, a safe place. A place where we focus on men's needs, because a lot of times you'll get a doctor who'll go, like you say, you're just getting old, or we don't want to give this to you because it's going to do this. And it's not going to do that at all if you do it the right way. So for us, it's about giving somebody a safe place to do their therapy, where they're not going to have any massive side effects. They're not going to have crashes. And if they want to quit, they can quit and come down and go back to where they were when they started. And we've been doing for so long that it's funny because we have patients still from our very beginning, 2012, 2011. There's just regular orders and they're doing great. I see them. Sometimes I'll see where they moved, and sometimes I see they moved to a much better neighborhood now. They're doing really well. I think, that's great. It's like when I was doing real estate. I love to see some old clients. When I was showing houses, I see an old client sometimes, and they're like, "My house has doubled in price since you helped us buy it." That kind of stuff. It feels good that you're doing something positive.
Yeah,
to affect other people.
No, that is nice. So what else do we got outside of the testosterone thing? What are sort of some of the things that people come and check you out for?
Here's a big thing right now that I hear all the time. Okay, there are peptides, okay? And there are peptides that go in your skin and everything, and a lot of it's baloney. There are lots of manufacturers who make peptides that are not available legally, and they're labeled for research purposes only. And then we have companies out there posing as pharmacies that are selling these research chemicals that are probably 10% peptide, 15, 20, they've been tested. We've done science, they've done some big testing. Most of those research purposes only are like 15% of the peptide that you're paying for. They're cheap. And they're sold by influencers. And I get a lot of calls. Well, I was on this podcast and this guy's selling this Wolverine stack and blah, blah, blah.
I love that one.
Stuff is not Is someone making money out of people who don't really know what they're doing? You know, I have a lot of friends. I like them. I see them kind of, I don't like you sort of grifting a little bit on their websites and podcasts. They don't have physicians. They're selling this stuff as safe. When I'm looking, I'm like, this has not been safely tested to be used for long term. This particular peptide. Peptides that we use they've been around 30, 40, 50. Some of these peptides have been around that we're using now have been around for 30, 40 years. They've been tested extensively. They're really safe. They they go into your pituitary gland.
Mm-hmm.
They'll target for weight loss, fat loss, erections. You can do erections without any chemicals. You know,
yeah.
They can do some really cool things. The healing peptides, one of my favorite is the BPC 157.
Everybody loves that one.
Or the pentadecapeptides, another one like that.
Mm-hmm.
The TB 500. Those are really beneficial for aging. Though they really make a difference in your like the GLPs. They make permanent changes that really help us age better, feel better. Use them 2 or 3 months, your pituitary gland's already turned on again.
Interesting. I was going to ask about that. Is this like a sign up now, you're in it for life thing, or do you?
No. That's the great thing about it. You can get really good results in just 2 or 3 months of therapy. You can get really the fat, the visceral fat loss, the leaner muscle, more muscle density. They can just be done for a while. The BPC 157. If I had a tear in my bicep from doing too much weight on my lifting, you're never going to heal that without surgery. BPC 157 does a lot of healing. It's just talking about Lindsey Vonn the other day. She has a tear on her ACL.
Mm-hmm.
And she's planning on competing like in a week or two, whatever it is, and competing in skiing, which is super dangerous anyway. And she's like, I'm gonna be back on. I'm not stopping. I'm gonna go on. And she's getting older now too. I wonder I hope she doesn't get hurt, but she's probably using peptides to heal. I know that.
Yeah, I mean, we've got friends in the medical device med bed type things, and like those, when you talk about the elite level athletes, the length, the knowledge that these people have now is like just jaw dropping. Like they're like PhD level, like knowledgeable about some of this stuff, and it's crazy. I mean,
especially in those high level, because everything they can do to extend their career is huge.
I'm pretty sure they're probably pretty well used in professional sports too. They just don't, and it's not like an enhancing type thing. It's just a way to heal. And I'm always curious, like,
from a professional athlete standpoint, even taking like an aspirin, you're like, I'm not telling anybody about this because like you don't want to give people the wrong idea.
My clinic is private medicine, so it's not in the insurance system, so we don't share anything. And I can never talk about, we have to always be very careful of who we talk about. We have a lot of like Rangers, Navy SEALs, they're getting older. Like they're hitting 40 and their bodies are beat up just like an NFL player. Their bodies have been, they've reused themselves really hard. And they're able to stay alive better. They're more active. They don't get injured. They're still in the game on the peptides or TRT.
Right. That makes sense. I mean, and like those people too, though. I mean, the thing they all have in common is a drive, of
That's
some
what
kind.
I always say.
Like,
I say you have to. I don't hunt people down that come to that make inquiries on my clinic. If they want to come be a patient, I'll call them back. I'll do a text message, and then I'll just be like, okay, I'm not doing 5 calls to get somebody to come in who doesn't really want to be here.
Sure. Mm-hmm. Yeah. No. You don't need to.
And there's a lot of sales. I'm a marketing degree too. There's a lot of sales pitches where, you have to do this 10-step thing, call them 10 times until they give in. But I don't want someone coming in who really want it, who doesn't have that drive, doesn't have that. I say, I hate to be elitist, but high achievers do really well in our clinic because they're interested.
For sure.
They're interested in maintaining themselves and being their best. And so that's like, I'm always like, if I talk to somebody, I'm like, you're speaking my language. And
of course. They're like, sign me up, dude. Yeah. So like when people come to you on the longevity side, are they sort of like quarterly patients after the acute part is done, or are these
become, maintenance? We just check in, do maintenance. And and also if they want to get involved with our social media too, they can learn a lot as we're experiencing our own things with, we do a lot of social media where we're, the people that work in my clinic they're sharing their own experiences as a young father on this, or as an older man like me, is in his 60s now, or anything like, there's a lot of things that demystifying is always a good thing, and also showing how it actually works in real life is a big, It's a big game changer.
Yeah, and I love
story.
that. It's almost like they say may you be born in interesting times kind of thing. And like I think we really live in an interesting time because we can have all these options. And I mean, you still get hit by a bus walking to the clinic.
I would say we live in the best time ever because we have so many things happening that are making our lives better. Medically, physically, we're learning how to use our bodies better now. I think people are learning a lot. And I think we live in as far as you want to stay alive as a human, it's probably the best time to be alive, right?
Yeah. It is definitely interesting. And I think it's been very cool to sort of watch what's happening because now I'm at 50. What's the world going to look like when I'm 80? Right. Like, like, that's a long time. I mean, in these terms, 30 years is a fucking eternity. Like that's.
I'll have beachfront. I'm counting on beachfront property here in DC.
Yeah, right. Exactly. Yeah, exactly. Yeah.
That property value rise.
Yeah, exactly. Yeah, that is funny. We actually
isn't DC a little low? Isn't DC a little lower than other surrounding areas?
I'm uptown a little bit. I'm on a little hill.
Okay. Got it. Yeah.
You got a little incline there.
I'm a little bit above sea level up here. So yeah.
Okay.
We got an acquaintance, David Hool, who's a futurist, though. He says, at what point should it be illegal to sell beachfront property on a current beach?
Yeah.
And I was like, it's just funny. So
I think like 5 houses went down in North Carolina. 3 or 4 or 5 houses went down in North Carolina last week.
Hey guys, hold on. Guys, all right, internet glitch is back. We're done. We're good. and we're back. All right. So yeah, Eric, I think where we're at was talking about people coming into your place on a regular basis.
It's basically, for the patients, it's basically us checking in with them, making sure, and then always being there accessible too. And when you're doing something that's personalized medicine, you want to make sure that they are treated with, every patient is treated with, great respect. And also nothing can ever beat weight. A problem must be identified, a problem must be tackled as soon as it happens. Everything has to, you can't let anything slide, everything has to be taken care of quickly. So you want to keep that trust going on. And having a new patient, it's a new education, it's costly. You're putting the time into a new person. And so you want to make sure your patient base is fulfilled, and
sure.
5-star reviews are the best, right? So
yeah,
and referrals are. We have some families where the father, his kid, and a grandchild is with us for different therapies. A lot of times it's weight loss stuff that we'll do for people. They're younger.
Yeah, that's it's that whole situation is weird too. Not to take a quick side tour. A friend of ours just had a heart surgery. He's in his 80s.
Oh,
he's very healthy. Otherwise, he actually had a little tear, a little valve leaking situation, right? So, but anyway, his dad had it and died at like 40 something, 49 or something, right?
Yeah.
But now this is a guy who worked on a farm, basically, like guy's strong as an ox. Now his son, who's in his 60s, had the same problem.
Yeah.
But he had it 20 something years earlier, coincidentally a week or two apart from each other, which was a very weird coincidence. But where I was going with this is like, I got to imagine that the grandfather in the equation that you just said is probably like, how is it that I made it this far in this degree? And then like these younger generations, it's almost like harder for them to get to that same level, it looks like, right?
Well, it may be declining hormones is what I really think it is. I think it's just, it makes it a little harder to survive. When you have your hormones are optimal, when you have an optimal reading of testosterone and a good reading of estrogen, so you have a good balance. Inflammation is the biggest killer right out there, really. That causes heart disease too. Inflammation is reduced significantly once you have everything balanced and running well. When you're low testosterone, you get frustrated, you're having higher inflammation levels, you have more chance of old age disease happening sooner. So he may have just had a different inflammation profile as well.
Interesting.
Which kind of exacerbated that. I'm not a physician to tell you that, but I think a lot about that too, because how we take care of ourselves is not always we can take care of ourselves really well, be working on a farm or whatever, but we're undermined a lot just by our environment, our food that we eat. And, I was thinking about retiring over in Spain, because that's a place I've enjoyed a lot in my life. And people live 5 years longer there. The adult male lives 4 or 5 years longer in Spain on the average than they do in the United States because the food's better.
Mm-hmm.
Food is much better. If you ever go to eat in Europe, I mean, your tomatoes taste like tomatoes and your food tastes like food.
Yeah. Well, the 2-hour nap in the middle of the day is probably not hurting.
That seems amazing to me too.
The one thing that's what sold me. Okay, I was like,
yeah. My wife's company has an office in Barcelona. She's like, this whole fucking place shuts down for like 2 hours.
That's amazing.
You can't go to the dentist until like 8 o'clock at night sometimes. Yeah.
I was like, wow, that would never work here, like ever in a million years.
That's kind of like when I started my clinic. I started therapy myself as a patient with a clinic in Florida. And I learned from them, but they didn't get to work until 10:30, and they left at 3 to go to the beach. And nothing ever got done. It was chaos.
Yeah.
And I thought, I can't follow this same model in DC. People are going to kill me. You know, it's going to die in a week.
I could see 3 patients today.
Yeah, it was ridiculous. I never knew what was going on with wonderful people, but their service was terrible. You just didn't know what was happening. And when you're on hormones, you want to make sure you have everything coming at the right time.
Yeah, didn't we talk about your client base? They're hard charging people. They're not going to sit around and take a fucking siesta in the middle of the day.
I think I don't want to look like a fool either. I should look good too, right?
Yeah, no, absolutely. So what's your sort of vibe on this for you personally? Like, I mean, as you go and get older, you said you're in your 60s now. You know, how do you see yourself sort of treating yourself for the next however long you plan on going for?
Well, I'm learning about recovery periods and how important that is. And I'm really, with me right now, I think one of the things that ages us is how we walk, how we move as we get older. We start moving as an older person. So I'm really into right now, and I do things on TV a lot. I do little segments on the local TVs in DC and around the country. And they always want to have a little movement. So I'll do a little movement therapy, show some movements we can do at our desk and things that we can do at home to kind of reduce blood pressure and feel better. So I'm really into movements now. So I'll start my workout. I'll go to the gym. I'll do it at home, and I always have a good stretch session too, where I'm really opening up I'm opening up all the muscle fibers. But I've started now because I'm doing it on TV. I want to make it really good. So I practice. I'll do it at the gym. I'll do like 10 minutes of like just movement therapy, and I've noticed that the more I do that consistently, the more I'm able to reach better, the more I'm able to move better, the more I'm walking at a better gait. And a walking gait's really important too. You know, the speed that you walk is important signifier of aging. So
I guess that makes sense, right?
As a 61-year-old, I'm very conscious of movement. I'm very conscious of joint mobility. Very important. I still have things that hurt. You know, I've been lifting weights for a long time. And it's that kind of protecting myself so that I will get to older age. I will make these choices now. Will make it easier when I'm 70, and that's going to come up before I know it. You know, it's scary to think about yourself being 70. But at 70, I want to be moving around really well. I want to be, you know, like I want to still look vigorous and feel energized.
I was talking to somebody years ago, and they said one of the age-related tests was a grip test, and I said, "Well, what does that tell?" And they said, "Yeah, it's to arrest a fall. Like if you can grab and hold your shit up." I was like, "Oh yeah, that makes total sense." Actually, I'm
a big pull-up guy. I've been doing pull-ups my entire life. When I was young, I used to move around. I have my pull-up bar put in my doorway. And I always think of myself in a movie. I'm hanging on the end of a building ledge. You know, how am I going to get up if you're not strong, right?
Yeah. So no one's pushing you off a building anytime soon.
Well, if they do, I'm going to have to hang on and get up. You know.
You see that fucking crazy bastard who just free climbed that 101?
That was incredible. I didn't watch the whole thing, but watching him makes me very nervous. I'm not a big heights guy.
Yeah. Talk about grip strength. That motherfucker, man. Holy shit. That dude.
For that kind of endurance too. I'm an endurance athlete more than anything else. In a lot of ways, I like keeping my lungs like strong.
Sure.
And just having muscle fibers that don't fall apart too quickly either. So I do a lot of hanging too. I do a lot of hanging leg raises and pull-ups. So to maintain that grip strength is important.
It's crazy. Yeah. I mean, and hanging is one of those things that I find very weirdly difficult to do. And
it's very hard.
Yeah.
It's very hard.
It shouldn't be though. Like it feels like all you're doing is hanging there. Like, you know, you're like, how's this so fucking hard?
Pick up a dead weight, 180-pound body. Can you do that? Okay. You know, I had a dog that passed away recently, and the dog was 65 pounds. But when that dog, we did it at home. We put, she was euthanized at home. picking her up at that point was really heavy.
Yeah,
You think about a body too. Our human bodies are heavy.
Yeah.
So.
I mean, I euthanized both of my pugs at home too, but those dogs were like 12 pounds, and even those dogs were like, just like, oh God, you got really heavy. I don't remember you being this
the most
heavy.
horrible time in your life, but it's also nice doing it at home too.
Yeah, I know. That's sort of one of our things here. That's the only way to kind of go. But hanging, even like, actually, I did one of these like internet mobility things a few years back just to see what it was like, because I was curious. And like the first thing out of the gate, she's like, hang. Work your way up to hanging.
Honestly, that's how they trained me to do pull-ups, man. You know, I'm not that small of a dude, and when I was powerlifting, he's like, "Look, if you can get at least one pull-up, you're ahead of most people if you're over 200 pounds."
Yeah,
and he started me with a 45-second flexed arm hang.
Yeah.
Oh, interesting. Yeah, I got to put that back into the rotation. I actually do, but where I was going with this, Eric, is like, if I don't stretch for 2 days, I feel absolutely terrible. And
me too.
So it's like table stakes for me now. But if I do really lean in on stretching, because like I have an injury or something, stretching is like one of those magic things that just, you get better really fast. Like and you
get more into it. The more you do it, the more you're able to actually feel it better, rather than just doing a movement. Your body starts to intuitively, I say, it starts to relax and start to trust your body more too.
Right. Yeah. And that intuition thing. So this just came up on a recent show too, is like, I'm so dialed into my body now that when I'm out of homeostasis for anything, even a little tiny bit, it's like, what is that show? That story, The Princess and the Pea, she feels that one pea under like 1,000 mattresses.
Under 1,000 mattresses.
And I'm like, I feel like that's totally me, but that, I don't know, years of yoga, meditation, stretching,
because you've set yourself up to protect yourself in a way that's functional and holistic, and it's like when you jump out of that and you go to Vegas. I just had a conference in Vegas and I was in bed every night at 9:30, but there are people high and drunk at 6 o'clock in the morning when I'm getting my coffee. They've been up all night, and I'm just like, and they look terrible. They thought they looked good, but I'm just like, what are you doing to yourself now? Is this something you do like a bender every month or two, or you have like a little, but you're really, those take so much time to recover from too.
Oh man, one of my favorite places on the world to run is the Las Vegas Strip. I
love running there too. It's really hard.
It's really hard, but then listen, it depends on what your contract with yourself says. Do you run up the escalator? Do you run up the stairs? Do you kind of mix it up? Yeah. Like, listen, if I'm being honest, like if you go from Strat to the Four Seasons and back, it's like an 8.5 to 9.
That's a long ride.
Yeah, it's a long run.
That's a really long.
You get to the middle of that run, you're like, I'm going to run up the escalators now because there's one of these everywhere.
I'm a 3 mile maximum runner. I just think you can get a good run. I'm not the 8 mile to me. That would kill me anyway.
I only do that because I'm in Vegas and I can.
It's fun.
It's so much fun.
To see. Yeah.
And I used to be bigger. I mean, on a week, 10 years ago, I would clip out a 20-mile run on a weekend without even batting an eyelash. Yeah. Like it was like, no big deal. But then I was like, I don't know, if I can't justify a 4-hour round of golf because to be away from my family, like why would I justify a 4-hour run? Like
that's what I wonder about some runners. I wonder how much some of these runners are. I wonder how much time they're taking away from their family.
Too much. I mean,
I do. I kind of. It's an escape, I guess, in some ways, but I see a lot of people are training. A lot of these young kids are training for marathons. It's a big hobby now. And they're running usually in groups, which is kind of fun, I think.
Which is cool. There's a group dynamic.
It's much cool. I like walking with friends. I used to walk with some friends that I've known for like 40, 45 years. And just getting together with the guys, for a couple hours on Sunday morning was just like the highlight of my week.
Yeah, that sounds good.
I wouldn't go for a 6-mile walk in DC normally, but doing it with the people I've known since I was 19, 20 is kind of fun. It's cool.
No, of course. That is.
We used to be the coolest guys in town, back in the day. It's like, hey, the gang's still around, So
it's funny. I did an Olympic a couple years ago, and I was one of the older guys in the, there's obviously guys into their 70s, 80s, whatever. But for the most part, the pack, I used to be more aligned age group wise with the pack. Now I'm not.
Yeah. Now you're like the veteran.
Now I'm like the But what was interesting though is I was talking to a couple guys in Corral for the swim, and they're all like HRV training, their Watts training, like they're like, it's a science project for them. And I'm like, God, I fucking love this. Oh my God, I love it.
Yeah.
No, look, my first Ironman, my brother did one and I did the relay that year and I fell in love with it. I'm like, why am I not doing this whole thing? I've already rode 112 miles on a bike, you know, like all I'm missing is a marathon and a swim. But like my brother's training was fucking incredible. It was like 40 hours a week and it was all this crazy shit. And I was like, I'm never doing that. I've got a baby at home. I've got no way. So I got into the sort of biohacking thing just to do that more scientifically and easier.
Yeah.
But these kids now are doing it. I mean, everything is a science project. I mean, they've got the watt meters and their pedals. And
I think it's too much. I think it's too much for me. I think it shouldn't be so complicated to do something physically active. To me, it's
you're not
a lot.
wrong there.
I think it's just. I see these people, they're influencers, and they have so many gadgets and things, and they have this thing and that thing, and they get to the point where you really can't live without all these things helping you.
Yeah,
you know,
I went and ran a marathon in California with two buddies of mine and it was great. It was his first marathon and I was like, oh, this is great. You know, so we hung out, but his uncle came and saw us at the finish line. Now his uncle's been he's one of those like California natives who's been running through the sequoias, since the 60s, 70s, you know, like he gets there. We've got our fanny packs on and our gels and our goos and everything out. And he's like, shakes his head. He's like, the fuck are you guys doing? I'm like, well, what would you have run it in? He goes, I've run like 30 of these and I ran them in like a pair of Reeboks and some basketball shorts. Like,
that's what I mean. I guess it's a generational thing too.
Yeah.
One thing I'm really into is just the VO2 max and just getting as much lung capacity as I can. That's really important to me, just training on hills. You know,
what makes you like that so much? Because I'm just starting to turn that stone over.
I think it's me being stubborn about aging and that I'm accepting my age for one thing. I want to be as strong as I can at any age.
Right.
So to me, it's more like my not my ego for others, but my ego for myself. You know, ego is a dangerous thing too. Egos can ruin you. But to me, about like, hey, I want to be honest with myself. Am I still in good shape?
Yeah, that's a way to kind of. It's a good litmus test for you, huh?
Yeah.
Yeah. I used to smoke when I was in college and a little tiny bit afterwards. So like I've always had this sort of like, maybe I got to make up for lost time situation back there.
It's way gone. So you're already repaired.
No, I'm not worried about that necessarily from a repair, but I'm always like, you know, like kind of thinking to myself, VO2 max might be something I want to start paying attention to before it's too late, kind of thing. Like, because I've never paid attention to it ever, not one time.
Yeah, that's something I didn't until recently. So I'm more like your guy in California running with a pair of shorts and a Reeboks. I'm more like that myself. So.
Well, listen, man, I could talk to you all day. Honestly, this has been you got a lot going on. I love that you're down in DC. I'd love to maybe come down and check out your clinic sometime. It's not too far from
we do telemedicine too, so it's very easy.
Even better.
So,
nice.
It's much easier nowadays. We really, I had been flirting with telemedicine before COVID, the idea of it, and getting our doctor in line with the idea, and then it just became such a natural. It became such a good way of doing our practice.
Sure. Yeah. That makes
patients
sense.
are happier. They're not waiting in the office for someone to come talk to them, and they're just. I think they're more relaxed and more honest on the phone, on the video call.
Sure.
That's what we want. We want people to be very honest with us, so we can really dig deep and get what they need.
Yeah, I talked to a guy we're trying to get him on the show. He's got a AI primary care physician product, and it's interesting because a lot of those.
Super cool, man. Yeah.
Super cool. Because it's not like, I mean, not for everything, but you know, those intake things like those new patient questions and stuff like that, way easier to talk to.
Get the menial stuff out of the way.
Yeah, I'd rather do that than have to talk to some PA with acts like a robot anyway, you know?
Yeah.
So,
I've told this story on air before, but the last experience I had with a regular doctor was when the PA had me take, for my physical, mind you, my annual physical, had me weigh myself with my Carhartt and jeans on, and I was like, "Are you fucking kidding me?"
Drives me crazy. I'm like, well, I told my doctor today that I had my diagnosis with, and I said, you know, I was very honest with him. He's a cool guy, and I was like, you know, I don't like PA and NP medicine because I always feel like it's just a cookie cutter thing, and I'm out the door, and I don't really get good. I don't feel like I'm talking to anyone who really cares, and that's really wrong. People are really mad at me That's my experience. Okay, it's not all PAs. Some are really brilliant. Some are really amazing. I have not had a good experience in DC with one. So
I would also say, Eric, not defending one way or the other here. I think that can be also the format in which you're interacting with them, right? You know, if it's in a hospital, if it's in a high volume clinic, if it's
yeah. And unfortunately, that's just not for me. So I can't function in that space.
I'm more like I'm more inclined to do a concierge medicine. Someone who knows me, who's going to be involved in my aging and my process of, eventually I won't be here. So I want to make sure I make the most of the life I have.
Right.
Even that's a crazy development to me, because this was like the family GP back in the day. They knew all about you. They knew who your family was. Yeah. They knew, and we replaced it, for better or for worse, in some ways much worse, with these highly specialized, let's crank you out, and you're not my guy. Get the hell out of here. I'm turfing you over there.
Well, also every interaction is a $30 copay or $40.
Yeah, exactly.
Every phone call, everything. The old phone call from the doctor to go over your labs now is a formalized copay system, rather than the old days when you'd be, hey, I have some bad news or good news, but I'm going to talk to you about your lab work right now.
Yeah.
Yeah.
It might be a call you get at 7 o'clock at night, a lot of times from the doctor too. And 15, 20 years ago, 10 years ago.
Right. Yeah.
I feel like we're going to end up on a whole nother episode if we keep going.
All right, Eric, where to find you? Where do we find you, man?
I'm most active on Facebook and Instagram at the Happiness Warrior Official.
Okay.
And I have a website, and I'm always working on it. So it's kind of updating right now with a lot of appearances I've had. But my website is thwarrior.com, and I take the warrior thing very seriously. Okay, so that's
you sound like it. Yeah, I love it. No, the energy's infectious, man. I appreciate it. It's great. It's great for a Friday.
You guys are great. Yeah.
All right,
cool, man. Well, listen,
we love this.
Thanks for coming by, Eric. I appreciate your time, and listen, good luck with everything, and have a happy weekend.
Catch up sometime in the future, I hope. Okay.
Definitely.
All right.
Take care.
Okay, guys. Thanks
a
lot.
Take care, Eric. Thank you.
All right.
Be subversive, irreverent.
Health is wealth, but you knew that.
Everybody knows that.
But so is following us on social media at Irreverent Health. And check out our website for more exclusive content at irreverenthealth.com.
Oh, I like this.
Thanks for tuning into this episode of Irreverent Health.